Hi, and welcome to Kayla's Brain on Drugs. Today we're going to talk about aspirin and ibuprofen. These common painkillers include Bayer aspirin and Advil. There are many times that you feel a headache coming on and reach for aspirin or ibuprofen, but have you ever wondered how these drugs work? First off, aspirin is also known as acetylsalicylic acid. The chemical formula is C9H8O4. This is a model of the chemical structure of aspirin. Aspirin falls under the salicylate class, while ibuprofen falls under the other non-steroidal anti-inflammatory agents class. This class is also commonly known as NSAIDs, or NSAID pain relievers. Both aspirin and ibuprofen are common over-the-counter drugs. What do aspirin and ibuprofen do? As you probably know, they are used to reduce inflammation, fever, and pain. Aspirin is also commonly used as a heart health regimen to reduce blood clotting. However, long-term use of both aspirin and ibuprofen may lead to stomach and gastrointestinal irritation. How do these drugs do what they do? Many cell types produce a fatty acid called prostaglandin. This modified fatty acid is the cause of many symptoms treated by aspirin and ibuprofen. Prostaglandins promote fever and inflammation and intensify pain. The modified fatty acid prostaglandin is made by enzymes called cyclooxygenase 1 and cyclooxygenase 2. In the body, a molecule of aspirin or ibuprofen will bind to a divot in the cyclooxygenase enzyme called the active site. This causes the shape of the enzyme to change, stopping the enzyme's ability to perform a function. In the case of aspirin and ibuprofen, the drug molecules inhibit the cyclooxygenase from producing prostaglandin, thereby reducing the effects of prostaglandin. That is why aspirin and ibuprofen reduce pain, fever, and inflammation. However, we said earlier that aspirin also helps prevent blood clots that cause heart attacks and strokes, and that both drugs may lead to stomach irritation. How do these things relate to cyclooxygenase? In the circulatory system, another product of the enzyme cyclooxygenase, called thromboxane, plays a role in platelet aggregation. This is something that leads to blood clots that may cause heart attacks or strokes. By taking aspirin, thromboxane in the circulatory system is no longer produced, leading to a decrease in blood clotting. However, prostaglandins also play a role in maintaining linings in the stomach and gastrointestinal tract. Use of ibuprofen and aspirin inhibits the production of prostaglandins in this area of the body as well as the rest. Therefore, prolonged use of these drugs helps the breakdown of protective linings in the gastrointestinal system. This is the reason why it is not recommended to frequently use aspirin or ibuprofen for prolonged periods of time. Along with avoiding prolonged use of aspirin and ibuprofen, there are a few other safety matters. The use of alcohol in combination with either of these drugs increases the risk of stomach irritation. The excessive use of ibuprofen while on a doctor-recommended aspirin regimen may inhibit the cardioprotection. In addition, ibuprofen may increase risks in pregnancy, especially during the third trimester. This risk involves the premature closing of a blood pathway between the right ventricle and the aorta. This blood vessel, the ductus arteriosus, allows blood to bypass the non-functioning lungs in the fetus. As the fetus nears birth, the vessel closes, allowing normal blood flow to begin. However, if the pathway closes prematurely, the fetus does not have the proper blood flow required for proper development. It is also not recommended to take ibuprofen while breastfeeding. However, overall, take it in moderation. There are no major health risks involved with aspirin and ibuprofen. Knowing the science behind the things you do every day helps you understand what's going on around you. But knowing the science behind the drugs you take helps you understand what's going on inside you.